as it's time for, once again, On Call with Dr. Ulich, and the doctor is in this morning, and he will be more than willing and able to talk with you about your medical-related questions. If you want to call him up, 377-1244. If you want to call him up, and he'll be glad to talk with you. He's also got some topics that he wants to talk to you about today as we hopefully get into the spring time of the year. The calendar says spring, but the outside it says different. Doc, good morning, and thanks for coming back with us.
Good morning. Thanks for having me back. Again, just to remind everyone, the show's on second Thursday of every month, and we talk about general medical questions. I usually have some topics, and then we also can call in and we can discuss anything from sports to medicine and everything else. But so anyway, just to what's going around town. Flu season pretty much over. Had a little spike a little south of here, but there's some sporadic cases here and there. But I believe the epidemic, at least in this area, is over for now. Hopefully, it can still go to about May, but we'll see. But since flu season is pretty much over, there are still viruses that you can get actually all year round, and seasonal viruses, and those are usually common colds. And people think, okay, common colds only in the wintertime or fall and things like that, but you can actually get colds in the spring, winter, summer, and fall. There's couple common colds that come in the fall and late spring, and they're just called rhinovirus and parainfluenza virus. Now, it's not the flu, but it's similar to the flu. And then there's other viruses called RSV and coronaviruses, and those are in the winter and spring. So you will see these, especially the coronaviruses and parainfluenza virus, in the spring. So you will see all of a sudden, okay, is this sinuses? Is this allergies? And sometimes it's hard to tell when to go to the doctor or not. So we're going to go over a couple the symptoms and what to look for, and obviously how to prevent some of these in the spring.
Okay.
There's also something called epidemic viruses like adenoviruses, and these are not usually seasonal. These have outbreaks all of a sudden, maybe at a school or a daycare or a hospital. They'll start to go, people that are exposed there, they'll get like these cold-like symptoms, low-grade fever, cough, congestion, and it's actually not one of these other viruses. It's adenovirus. Again, a virus. All viruses pretty much are not treatable with antibiotics, usually symptomatic treatment. Transmission of common colds. The most common is hand contact and also droplets. And there's just two different types of droplets. And just think of common sense. There's small droplets and big droplets. So small droplets can, when you cough, they can go up in the air and you can breathe them in and you can transmit it that way. The bigger droplets when you cough will not usually go as far, and they will land on a surface, and then you put your hand on the surface, and then you wipe your nose, your mouth, and that's how you can get some of these transmissions of these colds, like the parainfluenza and the coronavirus and some of these other seasonal viruses. People say, well, how long, if someone coughs on a table or coughs on me, how long is the virus stay alive until I can, until it stops transmission? So usually if a cold virus, a droplet, lands on your skin, it lasts about 2 hours. So if you don't touch that part of your skin and go up to your mouth or your nose, it will die and you won't transmit it. And really the big thing, and this goes back to daycares and military and hospital and schools, is risk is based on how much time you spend with that, with that group of people. And obviously the more people that you're around all day long and the more contact you have with them, the more likely you're going to get exposed. If they have the cold and the virus, it's going to be, spread to you. And also, it's amount of how much droplets and how clean you're keeping your house and using antiseptics and things like that. How most viruses are spread. We said, you got the respiratory viruses, which were more seasonal, which is influenza and RSV, and those are spread by these droplets that we talked about. One thing people say, well, I'll wipe it up. I'll use, alcohol or soap and things like that, antiseptics, and we'll talk about that in a minute. But there's been studies to show that porous materials like Kleenex and cotton handkerchiefs, actually, those are less likely to be spread to other people. The hard surfaces like the countertops and things like that, you can put your hand on there, and those are more likely. But if you actually have a handkerchief, obviously you wouldn't give it to someone else and let them use your handkerchief. But if you sneeze into a handkerchief versus your hand, okay, because of the porous material of the handkerchief or the tissue paper, you're less likely to spread it to someone else if it was on your hand and then you touch someone else. So, people like, oh, those handkerchiefs, they're those were back, my grandfather used to use those.
Yeah.
They don't necessarily recommend it, but you're better off with that than using your hand and then obviously touching someone else.
I don't want to get ahead of you if I am, but the surfaces transmitted the viruses that are on things like shopping carts, doorknobs, gas station pump handles, things that are commonly used by a lot of people. How long a window are we talking if there was a virus on one of those surfaces?
Yeah, again, about 2 to 4 hours.
Same for that.
Same for that. So the non-porous materials, like the things that you will be touching and other people will be touching, a couple hundred people a day, or a few thousand people. So it is about 2 to 4 hours.
Okay.
But if you think about it, if you're walking through, say, the school and opening the door, or the hospital, or the gas pump, how many people are going to touch that? And if there's an outbreak, for example, adenovirus or the common cold is going around, it's probably, if 100 people touch it, and it's that, you probably, within 2 to 3 hours, you're probably going to have someone that had a cold that touched that.
Sure.
So it's important to hand washing, and we're going to go into that right now. So how do you prevent it? Hand washing, hand sanitizers, and studies have shown that actually antibacterial cleaning products versus the regular cleaning products. So you have an antibacterial cleaning product, and we don't need to know, versus like a bleach or just a regular soap and water, actually has no better cleaning than a regular cleaning product. So you say, I'm going to use these antibacterial cleaning products, and I'm not going to get a virus. And to studies to show that even the antibacterial cleaning products only have a 1% chance better than the regular cleaning products on bacteria. Now we're just talking viruses. So if budget is an issue and it's going to cost you an extra $1 or $2 and it's going to hurt your budget, then just get the regular cleaning products.
Sounds like maybe more of a marketing ploy.
Yeah.
Really, isn't all soap antibacterial?
It is.
Really,
the regular Ivory soap the soap they made, thousands of years ago, and it actually works the same. So, one thing people don't realize, they think saliva can spread viruses, okay? And actually not. Saliva, obviously you need saliva to chew and make your food, but if you actually drink after someone's cup, okay, now if they sneeze in that cup or something like that, and then you drink it, but actually saliva itself does not spread the common cold virus.
So if you don't... Wife don't want to kiss you home from work because you got a cold. That's just she don't.
Well,
want
if you got a runny nose and a cough, there's probably a good chance when you go in to kiss your wife as you're breathing, you're going to transmit it. But people think, that saliva actually transmits. No, it's actually as you're breathing, that in and out, that virus will be shed through your nose, but not necessarily the saliva.
It's an airborne thing.
That's right. That's right. And here's another. Thing is they did a study of about, I think it was about 2,000 travelers, and they did a study, and I forget which airlines it was, but this was an interesting fact. So people say, oh my gosh, I'm going to get on an airplane, it's the cold season or flu season, and they say I'm going to get sick because if there's one person on the plane with flu or some other common cold, that I'm going to get it. So they did actually study to show a bunch of airplanes they took and recirculated the air.
Right.
And the other one, they took the air from the outside and then got filtered out. And they actually said there was no difference in transmission of viruses between either one. Now, obviously, you're in close quarters and it increases your chances.
Right. The odds are better.
The odds are better, but there's really no difference in, people say, well, they recirculate their air, so I'm going to get sicker on that plane, and it's actually not true. So risk factors for these common colds, like we talked about, daycare, and and goes about how long you're around that patient, around people. At-home parents actually have a greater risk of getting common colds than their spouses that are working outside the home.
Explain.
Explain. I know you think, well, this person's out working, and probably me doesn't go with pediatricians, right? Because I'm exposed to everything.
Good grief.
Because you're at a home parent and you're around your child who's either in daycare, and then they come home, or they're in school and they come home. So you're around them 4 or 5 hours longer a day than you are the parent that is working. So again, goes back to schools and things like that, and that passes to the at-home parent. And then usually, if you go home and kiss your wife and she's the at-home parent, guess who's going to get the cold after that? So you may not get it. You may not bring it home from work, depending on what your job is. Yeah. You actually may get it from your wife or the spouse that stays at home, and they got it from their child. Yeah. So that was an interesting fact. Also, psychological stress. If you're stressed out, if they actually says increase your risk of getting colds, because it actually drops your immune system. And actually you can have an increase. So if you're stressed out because you lost your job or money or whatever, you can actually have increased chance of getting a cold. Moderate physical exercise actually decreases the risk of colds, and that builds up your immune system. So that kind of makes sense. And then they said individuals with sleep loss or having trouble sleeping, again, stress. A lot of people will have trouble sleeping if they're stressed out, but people in general that have sleep disorders and are not fixed, they have increased chances of catching common colds.
I hope I don't get this debate about cold weather. If you go outside and you're not wearing a jacket, you're going to catch a cold. If you go outside and your hair's still wet you're going to catch a cold.
I mean, people.
What's the deal?
Yeah. Well, actually, did you read my notes before?
Sorry, I didn't.
Actually, we're going to talk about that next. But yes, that's a great question. No. There's been studies after studies after studies to show that actually that has no. Now you ask any mother, any grandmother, any father, or let's say but there's been studies to show that cold climate has no indicator, or a cold head has no. Okay, now if you have a cold head and you're stressed out and it's the cold and flu season. It's kind of the same premise of, hey, I went and got my flu shot, and then I got the flu 5 days later. Yeah, well. What happened was you were at the doctor's office, and there was probably someone with flu there, and that's where you got it from. So it's kind of the same thing. It's just that time of year, and people say they go out in the summertime with their heads cold, with wet hair, and because common colds are not as common in the spring and summer. But they say, there's no greater incidence actually in, say, the North United States versus Southern United States as far as common colds. There really isn't.
Now you might get hypothermia.
Yeah. Oh yeah. Sure. So the risk for like common colds and more is, we talked about sleeping, chronic illness, immune deficiencies if you're on chemotherapy or have an immune disorder, malnutrition. And here's the biggest one, and this is the biggest one that I tell my patients all the time because it affects my patients. It's like if smoking. For their children, if they smoke, either around them or even outside, it's on their clothes, and the parent themselves. Smoking increases your chances of getting colds almost 10 times than a person that their household does not smoke.
Is it because it affects your immune system?
It does. Okay. You have these cilia and things like that kind of push out the junk and the viruses, and that it tars it up, and your immune system goes down, and next thing you know, you're catching colds and things like that. most symptoms for colds, and this is where people, I think, versus allergies versus colds, and it's that time of year, is symptoms can be sore throat, scratchy throat, cough. Usually you'll have some nasal discharge and some obstruction and congestion, and then you'll get the cough. Most URIs, upper respiratory, which is a cold, last about 7 to 10 days. Again, in smokers, 2 weeks. Okay, that you can have this cough. And usually the cough, you get the congestion and the sore throat, that's gone in 3 to 5 days. And then that cough can hang out a little bit longer, maybe 7-10 days tops. And in smokers, it can last longer. Here's a big point that I get this every day, probably. I wouldn't say every day, but close to it. Oh, Dr. Ulich, I brought my child in because he's got green discharge from his nose.
I've heard about that.
And I love those grandmas out there because they have a lot of good advice for their grandchildren and their daughters and sons. But there has been countless studies to show that discharge, color of your snotty nose, or even your phlegm, has nothing to do with infection. Now, what that means is it could be green, and you could have an infection, which could be a virus. It could be clear and have a virus. But when it comes to viruses, discharge or color of your snot actually has nothing to do with it. Now, what else is going on? Are we having high fevers? This? That's a different story. But if you're just going to go to your doctor and say, oh, my kid's got a green, runny nose, he must have an infection, a bacterial infection, and these antibiotics, not necessarily the way to go, because you're just going to expose your child to more things when they get to the doctor's. And an even clear fluid. Oh, it must not be an infection because it's clear.
If you're having breakfast now, I'm sorry.
Sorry, yeah, you're right.
Go ahead.
So that is a big thing. And if people can get over that, it's what else is going on with your child? Are they having high fevers? Are they not eating well? Are they having ear pain and things like that? Depending on the age of the patient, is really a thing. And that's where I always say that's when you call your doctor's office first and say, hey, I got green, yellow discharge, but nothing else is going on. You call my office, we're going to ask, my nurse or I are going to ask you a few questions and say, hey, if they're acting okay, don't worry about it. Maybe it's some allergies, but there's no need to come in because they're green or yellow drainage from their nose, but otherwise they're perfectly fine.
What about the cold sore or fever blister? Does that mean you're about to catch a cold, or is it a result of a cold, or
right.
Is there any correlation? They call it a cold sore.
Right.
Does it really have anything to do with catching a cold?
It actually, no. What happens is actually a cold sore is actually most cold sores, unless it's done by adenovirus or these other viruses, is actually a virus that is already in your body. And you probably got it when you were a kid or got older, and it comes on your lips usually. Yeah, I got it. I had it too. And you usually get it mostly from your parents. If you get a cold sore before you start dating and kissing, usually that's where you will get it from. So what happens is a cold comes in, like a common cold, like coronavirus. It weakens your immune system, and the virus is actually in dormant out there, and then it pops up. So I get them too, and I can actually feel mine coming on.
I can too.
And I used to use a prescription, but I don't want to give them. Abreva is very good. It's over the counter, and as soon as you feel that cold sore coming on, start with that, and you'll delay it getting big. And because I was in my 20s, I used to get them bad. As I've gotten older, they're not as bad when I get a cold. But yes, that is not caused by a cold. It is caused by the herpes virus that's already in your system, and now you catch a cold, and then 5-7 days later, it weakens your immune system, or 3 days later, and then your cold sore pops up.
Because they say stress can bring it out. What you talking
yes,
about?
That's psychological.
Yeah.
That can bring out those viruses, and then you catch a cold and a combination.
Wow.
So usually 24 to 72 hours after you inhale that virus is when your symptoms start. Mm-hmm. So people, if they got exposed on Friday, and let's just say they went to their cousin's house or something, and they didn't get the cold till symptoms till Monday, it could have been from exposure, so that's what I tell parents also. It may be a day or two before your other kids get sick, especially if it was one of them are sick or you went somewhere else and things like that. A lot of people say, well, I got a cold, doc, and I got respiratory stuff. I need a chest X-ray, and
Wow.
some people come in and want it,
Yeah.
and a good clinician should be able to, do a good clinical exam and rule out what they call lower respiratory infections, which could be pneumonias and things like that. And then depending on if you have asthma and things like that, sometimes viruses can trigger your asthma and other things.
There are a number of now over-the-counter, I think, products that supposedly, if you take them at the onset of a cold, it's supposed to either lessen it or maybe help you recover quicker. Is this considered a cure now for the common cold, or is this just something to kind of make you feel better?
It's supposed to just help reduce the symptoms. Some cold products claim that they can reduce the time of the cold. Instead of 5 to 7 days or 10 days, it may last 3 to 5 days. But no, there is. I wish I could find it, because I'd be 10 times richer than Donald Trump if I could find the cure to the common cold.
Yeah.
So no, they help reduce symptoms. There's studies, and the problem is a lot of these medicines they have their own studies, so they're a little swayed sometimes. Yeah. I always say, children, especially the young children under really 4 to 6 years of age, there is actually no approved cold medicine. Okay, there's a couple that you can use, but for the most part, when I recommend cold medicines for under 4 to 6 years of age, it kind of what they call going off label. And so, the adults, I say, hey, use what works for you, but remember, hey, I've been taking this cold medicine for 3 weeks now, and I can't shake this cold. It may be time for you to go, to the doctors. Now, it could be the cold season, and you might have got back-to-back colds because you're a teacher or you're whatever, or you're just around a lot of people, and people say, oh, but that's probably, depending on your age too and your symptoms, if it's lasting more than 2 weeks if you're a smoker, 2 to 3 weeks, anywhere around there, and getting worse, then you really need to get in and see your doctor.
This time of year, I guess we're kind of considered as the middle of allergy season, I guess depending on where you live in the country. But down here, people have been kind of dealing with it since probably mid-February.
Right.
That's a situation where you either get it or you don't. There's not a whole lot you can do, is there, to prevent that stuff getting
there is,
down?
in the sense of, at my office and a lot of doctors' offices, you actually, there's some good allergy testing. And if you can get a little head start on starting allergy medicine. And what I usually tell the patients that I know are that we know every spring they're going to get severe allergies. So I usually like to tell them around holidays, and depending when Easter falls, I'll say, all right, Easter or Martin Luther King Day, we're going to start you on your allergy medicine. And then if the pollen count, if that's what they're allergic to in the spring is really high, then we're going to double your medicine as soon as you see your maintenance allergy medicine isn't working. Obviously, you don't want to over-medicate someone.
Right.
And again, allergies like colds is how miserable is it making your life? People say, well, I don't want my 6-year-old to have a runny nose at all. Well, is it really bothering them? Because medicines have side effects. You could give the wrong dose or whatever. So sometimes you're cheating, and I know parents are, you're, oh my gosh, my kid's got a runny nose. You're kind of treating yourself sometimes too, or they go, oh well, if someone sees my kid's runny nose, they think I'm, not getting to the doctor.
Yeah.
And the reality is, a runny nose may be allergies, it may be a common cold. If it's not bothering them, just make sure they maybe don't get anyone else sick if it's something, and otherwise, just use allergy medicine intermittently and not every day to say, hey, I got to stop this runny nose. And remember, your immune system, especially as a child, it's good to get exposed to things because when you're younger, depending, if you're over, 1 to 2 years of age, that builds up your immune system. So when you get older, 15, 16, 30, 40, your immune system's ready, and you can handle it better. So I'm not saying throw your kid out there if you know there's a some kind of epidemic, but
Right.
but it's okay to take your children out, even if there's something going on. It's some people get home, lock them up for the winter and the spring, and,
Yeah.
and go from there. So I know that's to a little extreme, but yeah, that is it's good to get kids exposed to things depending on their age.
You're on call with Dr. Michael Ulich here on AM 1240. If you want to call him up and ask a question, it doesn't have to be related to colds or allergies. You don't have to say who you are. Just ask the question, and he'll do his best to find the answer for you. The live line number is 377-1244. Only got about 4 minutes left, so if you're thinking about calling, you better make your decision. We're working on towards the 8 o'clock hour. And I may be getting ahead of you again here, Doc, but since we are in the springtime of year, because this may be a topic for a future show, but this time of year, we're seeing more, bugs, insects, stuff flying around. People get bit, people get stung. What do we need to do for that type of thing if, depending on, if you get a bee sting
Sure,
or wasp
sure.
sting,
So-
spider bite or something like
Yeah.
that?
So remember, obviously, if you have a known bee sting allergy, have your EpiPen around, and they make what they call a double EpiPen now. So you should always have that around if it's a child with the mother or the father or at school. And for school age kids, I know summer's coming up, but really, you should have an EpiPen at school, and you should have one at home, and when you travel. The big thing with children, but really adults also, is spider bites. Okay, that's a big, I got bit by a spider. Well, spider bites usually hurt pretty quickly after you get bit. You may not feel it go in real quick, but within 5 to 10 minutes, it hurts almost worse than a bee sting. So I'll get a lot of children that come in or parents, and there's a little rise in there, and it's a little swollen and red, and maybe some pus underneath, and it slowly came up. Well, everyone thinks they're spider bites, and those are usually not. Those are actually probably infected insect bites or a cut, and everyone blames it on spider bites. It's kind of the same rationale about if it's green discharge,
Yeah.
it's an infection. So that's that. So now what do you do about it? Now you go to the doctor, or they have to lance it, and antibiotics, either topical or oral antibiotics. So so this time of year, bug spray, especially coming up. Hopefully we don't get any of those mosquito diseases like we did a feyou years ago.
The West Nile.
Yeah, the West Nile.
Very rare for this, but I mean, south of Louisiana
Yeah,
it hits
yeah.
it, but up here it's kind of rare.
You other things, it's not as things like more serious, like Rocky Mountain spotted fever and Lyme's disease, and
That's
those
from
are
the
from
tick,
ticks and
yeah.
things like that.
Yeah.
So that's when you're out in the woods. Of course, a lot of people, it's hot out, so they're not wearing a lot of clothes. But if you're going to be out in the woods, especially in the summertime, you're going to definitely want to keep covered with light clothes, and that'll prevent a lot of these, from getting bit by ticks and things like that.
Also, you mentioned the camping, fishing, swimming, sunburns.
Mm-hmm. It's common.
That's common sense stuff there, yeah.
Sunscreen. They make now sunscreen with insect repellent also, and so you got a kind of combination. So they tell everyone that you need to put sunscreen on, no matter how old you are, no matter even they say what your skin color is like. They say everyone should be on because of melanoma and skin cancer, and that is actually on the rise due to ozone and a couple other things that's going on in the world. But that has come up. So yeah, sunscreen really important, keeping you covered, and they actually make sun clothes that are UV resistant.
Right. Yeah.
And ideally, especially for children, they say UV, and it's expensive. UV resistant clothing and sunscreen, and keep them covered, especially babies.
Quickly recap, flu season winding down, not out of the woods yet,
Nope.
but it's heading there. Big thing now will be probably colds, allergies, and those are the things to kind of watch out for, at least for the next.
Probably the next time I
for
see you
sure.
or on the air.
Doc, thanks for coming in to be with us this morning. We always look forward to your visits. Look forward to seeing you next month with more good stuff for the folks to listen to and stay healthy.
All right, thank you.
Dr. Michael Ulich, this morning on call here on AM 1240 KASO. Stay tuned. We've got all your news coming your way at the top of the hour.